Okay, this is revision session 4 for modern medicine. You know the format and you've got the slide in front of you, so we'll just crack on. I'm still calling it beliefs about causes, but really we're into actual causes. This is not a belief, disease is actually caused by genetic preconditions, lifestyle factors such as smoking, diet, alcohol, and we've still got germs, although that's an industrial cause of disease, 1700 to 1861 to be specific, Louis Pasteur. It's still obviously true, so we're still interested in germs as diseases and infections as a cause. Diagnosis of illness, we're looking at technology. It used to be that you'd go to your doctor and your doctor would sit there and in the way that Thomas Sydenham pioneered, he would diagnose you in conversation by listening to your description of your symptoms. And that was groundbreaking for the Renaissance, but we've moved on now. Diagnosis is much more laboratory based, so your GP will be really a gatekeeper for further tests. They would send you for biopsies, scans of some kind, CAT scans, MRI scans, endoscopy, bronchoscopy, that's put anything with scopy on the end of it, or scope, is putting a camera into some part of your anatomy. Blood sugar monitoring for diabetes, ultrasound, x-rays, and it's lab based, particularly biopsies. It's laboratory based, blood tests, phlebotomy. It's sending some part of you away for analysis for further diagnosis to be absolutely 100% sure. Okay, so technology and science plays a big part in diagnosis, and you need examples like those listed there. Treatment. Modern treatment. This is the age of the discovery of antibiotics. Penicillin saved so many lives. Unbelievable wonder drug that kills infections. But we've got the precursors to penicillin as well. We've got the magic bullets. Salvarsan 606 and Prontosil. Salvarsan 606 was developed by Paul Ehrlich, who was a member of Robert Koch's team. So the things that inspired him or helped him would be discoveries of Robert Koch before him. So Paul Ehrlich, Salvarsan 606. That was for syphilis. We've got the second magic bullet is Prontosil. That's for blood poisoning, and that was developed by a guy called Gerhard Domagk. And he was helped by various things like luck. His daughter got ill, and he was able to use Prontosil to treat her. I mean, that sounds unlucky, but actually, in the long run, it was very lucky for him to be able to prove it. Prove his drug worked more quickly than otherwise he would have to. And also he treated Franklin D. Roosevelt's son, and that made him famous. That made his drug famous. We've also got more daring surgery due to well-developed anaesthetics and aseptic surgery. So we've got keyhole surgery, we've got robotic surgery, we've got transplants. Things have really developed in terms of surgery thanks to those things. We've also got new technologies for treatment in other areas, dialysis machines for kidneys that basically takes your blood out of your body and cleans it for you and puts it back into your body, performs the job that your kidney does, but it's a machine. And on the same lines, we've got prosthetic limbs. So you'll see fake limbs in the Paralympics and things like that. That's prosthetics. I suppose pacemakers come under prosthetics as well. It's anything fake that performs, anything manufactured that performs a function for your body. Bionic people, really. National Health Service is a new one from 1948 onwards. We'll go into that. It's a case study, so we'll look at that in more detail. And radiotherapy, new science, chemotherapy, things like that for treating cancers. We've got prevention, new preventions in the modern age. The government getting involved. We start to see the government getting involved towards the end of the 19th century with the Public Health Acts. There's one in 1848, which is optional, and then we've got the Compulsory Public Health Act of 1875, which obliges all councils to provide clean water and take sewage away and things like that. And that's really the end of laissez-faire. That's the government getting involved in improving the health of the people. Because there's a good reason for it. It's cheaper. It's cheaper to prevent illness than it is to treat it. So we've got compulsory vaccination campaigns. From 1942, diphtheria is the first one, preceding the NHS by 6 years. We've got 1950 polio, 1961 tetanus, 1968 rubella, and 1970 measles, mumps, and rubella combined vaccine. Government passes laws as well, so we've not just got the compulsory vaccination campaign, we've got actual laws that are designed to protect the health of the population. The Clean Air Act was designed to protect people in cities from smog, and they are in 1956 and 1968, two of them, the Clean Air Acts. We've got fluoride added to water to prevent tooth decay. You don't know it, but every time you drink a glass of water from the tap, you're taking fluoride into your body, and it's supposed to help prevent tooth decay. The Health Act in 2006, no smoking in public, so banned smoking in public, and go a little bit further than that. A little bit later, 2012, I think, I might be wrong, but worth checking. 2012, I think, was when it became illegal to smoke in a car with children in the car. So all these acts, all these government acts designed to protect people's health. And then the third thing we've got there in prevention is government awareness raising and lifestyle campaigns. These are like the anti-smoking campaigns, Stoptober, Movember, things like that, raising the public awareness of certain things that can save your life. Another one would be the obligation for tobacco companies to put horrible pictures of horrible diseases on tobacco packets. The advertising campaigns on TV, things like 5 a day. The 5 a day phrase in itself is something that is an awareness raising campaign, something that is designed to improve the health of the population. Okay. So moving on from causes, treatments and preventions, we'll look at the IIAS. And always remember the impact of these things. Always be able to ask yourself, can you tell me the impact of each of these things that we talk about? So first of all,
just reminding you about form this afternoon, if that's okay. I'm going now.
Lovely. All right. Bye bye.
Just do mind do a couple of decencies as well, sadly.
That's okay. I'll sort them out.
Just
Anyway. Always remember, can you tell me the impact of these things? Watson and Crick, first of all, individuals. Watson and Crick, DNA and the human genome. Rosalind Franklin was the first to photograph DNA. Angelina Jolie, significant because she opted for a double mastectomy due to the genetic link to breast cancer. Wilhelm Röntgen, X-rays. That's actually towards the end of the 19th century, but really became a significant thing in the early 1900s, so we include him in modern medicine rather than industrial. Paul Ehrlich, I've mentioned, Salvarsan 606. Don't forget the things that helped him. The German government, the work of Robert Koch, things like that. Gerhard Domagg was helped by Luck. And his own another thing for Paul Ehrlich. There's another Japanese doctor called Dr. Hatta, who actually helped Paul Ehrlich when he mistook Salvarsan 606. So it's called Salvarsan 606 because it was the 606th batch, if you like, the 606th experiment. And he actually missed it the first time around. And it was Dr. Hatter, his kind of like laboratory assistant who was helping him out, who actually looked at Salvarsan 606 again and corrected the mistake that Paul Ehrlich himself had made. So without Dr. Hatter, Salvarsan 606 couldn't have happened. So there are other individuals behind the scenes sometimes helping out. That's Hatta, H-A-T-A. Domagg, Prontosil, tested it on mice, that's blood poisoning, and he used it on his own daughter, I've mentioned already. Alexander Fleming, penicillin, 1928. Should give you the years as well for Ehrlich and Domagg. Paul Ehrlich is the 1900s, early 1900s, Salvarsan 606 being the first magic bullet. Gerhard Domagg would be the 1930s, so about 30 years later. Salvarsan 606, of course, for syphilis, Prontosil for blood poisoning. Alexander Fleming, 1928, the third magic, what they call the third magic bullet, penicillin. Now, he discovered it, or found it by accident, realised that it had some potential, wrote a paper on it, and then did very little about it. And then Florian Chain find Alexander Fleming's paper, and they set about trying to mass produce, or at least produce it on a larger scale. And they also experiment with treatments, treating people who are ill with infections. And they have some success, mixed success. A couple of people that they treat with it die, and they have to find ways of extracting it from patients' urine, because penicillin actually goes through the body, and you can extract it from urine once it's been used in decreasing amounts. But they have mixed success until World War II, and the American government gets on board and realises the potential of penicillin, and they pump lots of money into the mass production of penicillin. And the impact is that it ends up saving around about 300,000 lives of British and American soldiers in World War II, and of course countless millions of lives in the longer run, through the killing of infections, the neutralisation of infections through use of penicillin. So that's the significance of penicillin. Florian Chain and Fleming all got Nobel awards, Nobel Prizes in medicine for their contribution. Nye Bevin, and sometimes called Aneurin Bevin. Aneurin Bevin was his name, but he called himself Nye Bevin because it's easier to pronounce than Aneurin, presumably. And he was the Minister of Health responsible for creating the NHS. And I remember he had to push through the NHS against opposition from doctors. They really didn't want it. He had to fill their mouths with gold. That's the phrase that he used, because they stood to lose money. They'd been providing a service and being paid for that service, and they saw no reason to change it. And suddenly he wanted to make them into government employees, and they resisted. But he forced it through, and then the NHS ended up facing lots of problems in its early years. So we'll talk about some of those problems now. A big problem that the NHS faced was that overnight the government became responsible for 2,700 hospitals, the running of 2,700 hospitals and the paying of all those employees. And that's a big administrative overhaul, so they had to kind of step up and look after these hospitals. There was also more hospitals in the south than there was in the north, so that was something that they had to redress. They had to build more hospitals in the north. They had to find money to pay the doctors and nurses and other staff involved in the NHS. We've also got the problem that overnight it became free. Healthcare became free. When the NHS opened, suddenly healthcare became free. So all these people that hadn't been going to the doctor because they didn't want to pay for it suddenly decided that they would go and visit their GP. So we have waiting lists going through the roof or out the front door because people just are literally dying to see their doctor. Other problems to do with the NHS... it's massive. They take on so much. It's not just hospitals, it's also GPs, it's also dentists, it's also medical research, it's emergency services, if you need an ambulance, it's all under the NHS, the National Health Service. So it's absolutely huge. It's one of the largest employers in the world, the NHS, and we should rightly be very proud of it, but it was a behemoth and it needed to be tamed, and it still is. And see, these are the big problems that the Labour government that created the NHS faced in those early days. Attitudes, another thing that... I'll carry on with institutions. We've still got government campaigns, which I've mentioned already, part of the NHS, that again, funded by the NHS. Lifestyle campaigns, 5 a day, Stoptober, etc., things like that, and the vaccination campaigns that I've mentioned already. Diphtheria being the first in 1942, polio in 1950, and so on. You'll still be seeing that kind of thing. You are recipients of vaccination campaigns every time you have an injection in school. That is thanks to the NHS and this government vaccination campaign. So again, it's the government being involved in trying to prevent. Very good. It's not just the government being nice and kind, it's also financially sound because it's cheaper to prevent disease than it is to treat it. So attitudes, moving on. Big science, we've got an attitude of big science. You'll probably remember from the medicine in the 19th century and 18th century, new ideas are not well received. So someone like Joseph Lister with his carbolic spray and his antiseptic surgery, doctors didn't want to know immediately. It took a lot of convincing and a lot of writing of papers before doctors finally got on board with the idea of antiseptic surgery. Same with germ theory. Pasteur faced a lot of resistance. Took 20 years because people like Dr. Bastian were resistant to it. Nowadays we don't have that. Nowadays, new ideas are all invested in, and there is a genuine kind of cross-fertilization of ideas, and that is big science. That's scientists and researchers from all over the world coming together to work on things collectively. A lot of sharing of information, and rightly so. It's the best way to be. We're all stronger together, and science is no exception. So we've got things like the Human Genome Project would be a good example of big science. We have mapped the human genome, and it was because of a team of scientists who came together from all over the world in this big collaborative effort. So that's the Human Genome Project, big science. We've also got a new attitude towards improved health and lifestyle. So, we keep fit. We're members of gyms. We do things like that. And it's thanks to government advertising campaigns, raising awareness. Sensible people don't smoke and have a good diet. So these are improved attitudes. Science and technology, more things that have helped us in this day and age. A lot of repetition here. I kind of mentioned some already. We've got electron microscopes which help identify genes. They can magnify things to 10 million times their normal size. So electron microscopes, incredibly powerful microscopes, far more powerful than the sort of things that Robert Hooke was using in the Renaissance period. We've got X-rays, CAT scans, MRI scans, blood pressure, sugar, endoscopes, ultrasound, radiotherapy and robotics, things that I've already mentioned. But be aware, new science and technology is a big thing, and it's thanks to the NHS largely since certainly the second half of the 20th century. Moving on then, case studies. We've got penicillin is our big case study. I've mentioned a lot of this already. Alexander Fleming saw soldiers dying in World War I from staphylococcal infections, discovered penicillin by accident. A dirty petri dish was left out and a fungal spore found its way into the petri dish, and he found penicillin. Actually, technically wasn't the first to find it. It was found earlier by Robert Liston, but Robert Liston didn't do anything with it at all. Alexander Fleming at least wrote a paper on it and then did nothing at all. So after Alexander Fleming, we've got Florian Chain, who pick up the idea, they run with it for a little bit, they purify penicillin through freeze-drying techniques, and they experiment with methods of mass production and treatment, but it's not until World War II breaks out and Florian Chain take penicillin to America and the American government get involved in the mass production of penicillin that it really starts to take effect. Millions of lives have been saved as a result. About 300,000 soldiers were saved, and Florian Chain and Fleming shared the Nobel Prize in 1945. The second case study is lung cancer. We've got improved diagnosis techniques, a lot of which we've already mentioned. CT scanning using dyes, barium dyes, radioactive dyes in a lot of cases. Bronchoscopy is a camera into your lungs, like an endoscopy is a camera down your throat or somewhere else. Bronchoscopy is one into your lungs. New treatments, transplants, radiotherapy, chemotherapy, genetic research into pharmacogenomics. Pharmacogenomics is looking at the viability of the economic viability of new drugs. Pharmacogenetics is a related word. That's looking at human resistance to certain drugs. Some drugs don't work. So we're looking now more specific. This is this is a challenge for the NHS in the future, so it's worth making a note of, because you do get asked that. A challenge for the NHS in the future is to find treatments for the individual. Rather than just looking at one disease has one treatment, the NHS is now far more in line with the idea that one person has one treatment. So just because two people have lung cancer, one person may respond to a different combination of drugs, and that's pharmacogenetics. So because of their genetic makeup, different drugs have different effects. Okay. New preventions to do with lung cancer, government education campaigns, smoking bans, laws against smoking in public, laws against advertising tobacco, the Stoptober campaign I've mentioned already, the horrible pictures of diseases on the front of cigarette packets, things like that. Prevention is cheaper than cure, so the government's all about trying to stop people from smoking in the first place. Interesting point. Lung cancer costs the NHS £165 million a year in treatment. But government earns £4 billion from tobacco tax. And there is the ethical question, is it the government's job to limit personal freedoms? Well, what is right? Laissez-faire, government not being involved in people's lives, or the government actually trying to stop people or shape people's behaviour in a certain way? I know what I believe. There's no right or wrong answer, I suppose. Changing continuity, the last column. Change, lots of change in the modern period, lots of new things, as you can imagine. Causes and diagnosis. There's now a move to laboratory diagnosis through biopsies and samples rather than face-to-face consultation, in the vein of Thomas Sydenham, as he started in the Renaissance. So it's much more lab-based diagnosis. Move towards technology to diagnose with X-rays, CAT scans, MRI scans, blood pressure, blah, 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 the stuff that I've already mentioned. The studying of the genetic causes of diseases and also the genetic resistance to certain drugs, as I've mentioned, pharmacogenetics. Watson and Crick, the mapping of the human genome, things like that. All new ideas. Government intervention, real end of laissez-faire now. Advertising campaigns, vaccination campaigns, awareness raising, things like that. That's all new. New treatments, the magic bullets to begin with, Salvarsan 606 and Prontosil, and then penicillin. Then developments in surgery, robotics, laparoscopic or keyhole surgery, things like that. New antibiotics. Another danger that the NHS faces is that diseases become resistant, or infections become resistant to antibiotics. We're told, another example of a government awareness raising campaign, don't use antibiotics carelessly, because diseases, certain infections will build up a resistance to those antibiotics. And this is a problem that the NHS faces. Another problem the NHS faces is nosocomial diseases. That's a good one. I bet not many students across the country will use that phrase. Nosocomial infections are diseases that you pick up in hospital. So keeping hospitals clean, preventing infections like MRSA, the virus that you can develop in hospitals. They're nosocomial infections. The NHS itself is a new thing for this time period, brand new, 1948, new idea, pioneering National Health Service. No other country had one in 1948, we were the first. We've also got the problem of an ageing population. Because largely we've been so successful, we're victims of our own success. People are living longer. An interesting statistic, one you should embed in your brain, is in 1900, at the start of this period, 25% of deaths were due to infectious diseases. By 1990, less than 1% of deaths are due to infectious diseases. The things that kill us now are genetic diseases and lifestyle factors, not infectious diseases, which is great. That's what Thomas Sydenham dreamed of. That's what he wanted. He wanted to achieve that, and we've done it. We've achieved it. It's a great thing. It just means we've got an ageing population. People live longer, and we have other problems. Nice problems, I suppose. And prevention, changes in prevention, government vaccination campaigns and awareness raising, as I've mentioned already. Okay, last thing then, continuity. Some viruses are difficult to identify vaccines for, so it's an ongoing problem. New diseases keep appearing. Zika virus is a good example of one that was in the news quite recently. Lifestyle factors are down to individual choice, and we've got the ethical question, how far the government should intervene with people's lifestyle to prevent disease. And we've got the problem of the overuse of antibiotics. So we've still got, the continuity here, I suppose, is that we've still got issues. We've still got problems of germ-related or microbial-related infections. We've also got the worrying fact that some old diseases are making a reappearance. TB, for example, is back on the rise. Higher level detail, Gregor Mendel. When you're talking about genetics and Watson and Crick, well, we could mention Gregor Mendel as well. He was a guy who experimented with the genetic makeup of peas, of all things. Rusker and Knoll, electron microscope pioneers. Christian Barnard, the doctor who performed the first heart transplant in South Africa. And keyhole surgery, if you want to be really sexy about it, you could call it laparoscopic surgery. It just sounds cleverer. That's everything. The next revision session will be on trench warfare. Okay.